Hello guys, how are you doing? In today's video, we'll talk about why do dentists take x-rays. Every time I go to the dentist, they take about 6 to 8 x-rays for me. I'm worried whether x-rays are dangerous to my health, and I ask, why do dentists take that many x-rays? So that's our topic in this video. We'll discuss why dentists need x-rays in their practice, and is there an actual very high risk? Let's get started. X-rays are essential for dental practice for multiple reasons. But first, let's start and talk briefly about how do x-rays work. The concept of dental x-rays is simply to allow the doctor see more information about the teeth. Dental x-rays show what is behind the skin, what is under the skin. They show it simply as radio opaque material or radio lucent materials. For example, the bone is mineralized and very dense material. It prevents the x-rays from reaching the sensor, which appears on the x-ray machine as white or radio opaque material. On the other hand, the soft tissue appear dark on the x-rays. And here's an example of the x-ray. As we can see here, the teeth appear white. The outer layer of the teeth is very white because it's enamel and has very high level of minerals. On the other hand, the pulp of the tooth, as we can see here, appears a little less opaque. The bone is still white but less than the enamel, as we can see. On the other hand, all the other tissue, the soft tissue, appears very dark on the x-ray. And as we can see, these very white spots on the teeth are restorations. The manufacturers add so many radio opaque materials in the manufacturing of the restorations and other materials that are used in dentistry in order to appear in the x-rays, which will help in using them better. So this is the concept of x-rays. Very simply, let's imagine that this is a sensor. I put the sensor inside the patient mouth for a bite wing, let's say. So the sensor is inside the patient mouth, and then I expose x-rays from this side, from the machine, towards the sensor. When the x-rays are going towards the sensor, they will pass through the patient cheek. In between there is the teeth, the soft tissue, and the bone. The sensor, as we can see, is white. Whenever the x-rays arrive to the sensor, it turns it into black. Imagine as if it is burning it, for example, and turns it into black color. The more x-rays reach to the sensor, the darker it gets. So let's say this area receives very high quantities of x-rays, it will become all black. On the other hand, this area didn't receive enough x-rays, it will stay whiter in color. So the x-rays that are passing through the dental tissue will be absorbed and reflected because the teeth are highly mineralized. They will get absorbed and reflected in higher quantity, and less of them will reach into the sensor. And that's why bone and teeth appear white on the sensor. On the other hand, x-rays pass through the soft tissue very easily because there is no minerals in the soft tissue and appears darker on the x-ray. And this is an example of the x-ray, as we said. And then the dentist uses the information that is obtained by the shape of the teeth and bone in creating a diagnosis, treatment plan, or checking treatment quality. And now we'll talk about how this happens. So how is that? It helps in diagnosis of diseases. For example, caries, tumors, cysts, bone levels, periodontitis, and fractures all can be diagnosed using x-rays. When we talk about diagnosis, x-rays are essential to determine the levels and extent of caries, especially interproximal caries, caries that start on the smooth surface in between the teeth. Why? Because this area is closed and we can't see it directly with the eye. But when we take an x-ray, it appears as a clear dark cavity in between the teeth, as shown in this picture, which allows the doctor to start the treatment before the cavity gets larger and larger. Another example of diagnosing using x-rays includes periapical lesions. The x-rays show the whole tooth, including the part that is embedded inside the bone, and this is perfect for diagnosing diseases that are hidden inside the bone. For example, in case of periapical lesion, we can see a clear radiolucent area on the x-ray, which is presented as dark area at the tip of the tooth, as we can see here. And depending on the picture and other clinical exams, the dentist can decide whether the tooth needs endodontic treatment, extraction, or any other possible choices. Another example is fractures. We take x-rays from multiple angles in order to diagnose any suspected fracture and then decide whether these fractures can be fixed or not. Furthermore, other jaw diseases can be diagnosed or at least identified using X-rays. For example, cysts. Cysts typically appear as radiolucent area or circle inside the jaw. Tumors as well can be in many shapes on the X-rays. I will show pictures to show examples. Some tumors appear as radiolucent areas. Some appear as even more radiopaque areas if they were growth in bone. Some appear mixed radiolucent and radiopaque. And depending on the X-rays, the dentist can get an idea of what type of tumor we have, and with further diagnosis using biopsies and other diagnostic tools, he can reach to a definitive diagnosis and then start a treatment plan. So in many cases, X-rays are not enough to reach a conclusive or final diagnosis. Instead, we need other adjunctive diagnostic tools such as biopsies. X-rays on most cases help only in exposing disease, but rarely enough to come with a definitive diagnosis. Second, X-rays are very important in treatment planning for the dentist. In many cases, the doctor might need an X-ray only to develop a treatment plan, even though they already know the diagnosis. For example, implants. When the doctor decides to place an implant in the jaw to replace a missing tooth, they will take X-ray prior to the procedure, even though they already know that we need to place an implant in that area. This X-ray is taken only to study the levels of bone thickness and what size of implant is most appropriate to place in that area and in which direction. Orthodontists also depend on X-rays in treatment planning. Depending on bone shape and teeth location in relation to other bony landmarks, the orthodontist decides what is the best course of treatment to be taken. This is also true for prosthodontists. For example, when a prosthodontist decides to place a bridge linking between two teeth or a crown on a tooth, he might take an X-ray for that tooth in order to see the crown to root ratio to determine whether the tooth is able to withstand the forces implied on it by the bridge. And lastly, number 3, checking treatment quality and follow-up. Dentists might need X-rays in order to check the treatment quality. For example, a conservative dentist might make a restoration but then expect that this restoration might contain an overhang. Overhang happens when the restoration is not in smooth contact with the surface of the tooth, as we can see here in the picture. Sometimes the overhang is not apparent, especially in the back teeth. So the dentist might take an X-ray to see any fault in the restoration, bubbles, separation, or overhangs. And here's an example of picture of a restoration that appears perfectly fine from the outside, but when we took X-rays for the restoration, we see that there is an overhang. In addition, a prosthodontist, for example, might take an X-ray at the metal try-in stage to check if there is any overhang in the metal or ill-fitting metal over the preparation of the tooth. In order to have a high-quality treatment, we need the metal frame to be fit completely perfectly to last the longest possible. And if it was bad enough, the prosthodontist might need to restart the procedure from the beginning. And last but not least, follow-ups. X-rays are very important to follow up and decide the success of treatment over a long period of time. And this is used mostly by endodontists. For example, after endodontic treatment, it is recommended to do follow-ups after 6 months or sometimes 1 year after the treatment to check the healing of the periapical lesion. This is an example of a follow-up X-ray. This X-ray was taken directly after the treatment. As we can see, the radiolucent area is still there because the bone will take months until it starts healing and start filling up the space. And this is an X-ray after 1 year of the treatment that shows that the bone starts to heal later on, which indicates successful treatment. If no healing occurs or the lesion is getting even bigger, in this case the endodontist might need to redo the root canal. We talked about the most common uses of X-rays. Now we'll talk about the types of X-rays. And now let's talk briefly about the types of dental X-rays. These are the most common types of X-rays taken for dental practices. They are divided into intraoral and extraoral X-rays. Intraorals are X-rays that are taken from inside the mouth by placing the sensor, the small sensor, inside your mouth, allowing you to bite, then exposing the sensor to a certain level of X-rays. The extraoral X-rays, like the panoramic and CT scans, where you go to the large machine, stay steady, and the machine takes the X-ray. Both this the sensor and the X-ray source outside your mouth. The major two types of intraoral X-rays are bite wings, as shown right here, and periapical, as shown in this picture. Bite wings can be used to decide the level of the bone, as we can see in this one, and interproximal caries. Periapicals can be used to decide whether there is periapical lesions, fractures in case of trauma. The extraoral X-rays, when we talk about the panoramic X-ray, it is this one. You probably have taken one already. It's used to diagnose the wisdom teeth, if they are present, need extraction or not, to check jaw lesions, tumors, and it's used also by orthodontists, and in case of jaw fracture or some types of trauma. CT scans are most commonly used by endodontists and implantologists. When there is tricky case for endodontic treatment, the endodontists might take a CT scan in order to see the atypical canals of the teeth, and for implant it's used in tricky cases also to determine the width, length, and the amount of space that we have for the implant. And for the cephalometric X-ray, it is like this one shown right here. Cephalometric X-rays are mostly used by orthodontists for treatment planning and diagnosis of the bone relation, and that's it. And lastly, we'll take about the risks of dental X-rays. It's proven that X-rays can cause cancer. Yes, then if that is true, why do they still take X-rays in hospitals, clinics, and everywhere? Isn't the health system supposed to protect our bodies, not causing any harm? The answer is very short. The benefits of taking X-rays by far exceeds the possible risk. This is true because the number of X-rays used to take dental radiographs is very small, to the extent that it almost doesn't affect cancer risk. For example, the amount of X-rays used in a bite wing is approximately 0.001 millisieverts, equivalent to the effect of the average amount of UV light you get daily. The risk of having undiagnosed disease due to not taking X-rays is way worse than taking X-rays. With the advancement of technology, our machines can take better quality X-rays using fewer and fewer rays per shot. And that's it for this video. Thank you so much for watching. Please like, share, and subscribe to see our latest videos and support the channel. Thank you so much and have a great day. Goodbye.